right, guys, we're about to get started with Dr. Pradeep Sethi and Ajit, one of his patients. It's going to be a cool interactive Q&A session. So I hope you guys got your questions ready for Dr. Pradeep Sethi and Dr. Ajit. Patient Ajit. Okay, so Dr. Pradeep, let me go ahead and go live with you. All right, we're just waiting for Dr. Pradeep Sethi to accept it, and we'll go live. Hey, how's it going, guys?
Yeah, let us.
Yeah. Perfect.
Melvin,
you guys are great, man. I know. I'm waiting to see how long it gets. Trying to be like Ajit.
You gotta shape it like this.
I know. That's what you gotta let it grow a little while, right?
Yeah.
To shape it. So yeah, I'm gonna try to shape it afterwards.
All right.
We're happy your beard, Dr. Pradeep.
Yeah. So I like how the new year was for you, like on first day of 2021.
All right, so looks like we got a good amount of people here to get started.
So let me introduce
Yeah, absolutely.
Ajit.
Introduce.
Ajit.
That's Ajit.
Melvin, you know that like he was searching for his hair restoration for 20 years, and he did his research, and wow. Somehow we connected magnetically on spiritual grounds, and he developed the trust, and he got his hair. He says that he's the Mona Lisa, but you should listen to his story. Like, that is of lot of interest to a lot of people, how he did his research for 20 years, 20 years. So,
wow.
Of course, like, I'm grateful that he trusted me and his results. I don't take the credit of his great results. I give credit to his trust. And of course, the area was small to do, but the most important thing was making it look impeccable. And the temple point,
it does.
That was, I think that's the best I've done so far. Do you feel so?
I think I'm his best work. That's my personal take on it. Of course, he's got other brilliant results, but I just feel so the day I came to him, which is about say 2 years back, and he just looked at my head, and at that point he had that foresight, and he said, this is going to be the best hairline ever transplanted on somebody. That was what he had said, and true to his words have come true, and it's exactly what's happened. I mean, that's my personal thing.
I have to agree. I mean, it looks fantastic. He hasn't met me yet, though, so we'll see.
You're a candidate to dethrone me, then, Melvin.
Yeah, I'm coming for
candidate.
Yeah.
Right.
So, all right. So I guess I want to ask you, Ajit, as a patient, how has a hair transplant affected you? How did hair loss affect you, and how has the hair transplant, changed your life?
So I'll talk about before the transplant, the issues faced before. The hairline, keeps going back. I mean, you do a lot to try and style it, to not make yourself look bald. At the same time, you want your hair to go up. It looks really smart when it's up.
Yeah.
But when you do that, with the receded hairline, the bald patch, the bald receded areas start showing. So it's a matter of concern, right? You want to look there, but eventually with the receded hairline, you are bound to look old. And that is what I had faced. I mean, to go short, to cut it short, or to grow it long like that, to cover everything. I always loved a buzz cut. But unfortunately, even with the buzz cut, the patch was, it was very Bill Murray kind of buzz cut, But really, these 2 points were inside, and it was only the widow's peak which was strong. And the temples also going. So even the buzz cut didn't look good, And eventually, I mean, like I said, I've done my research of over 20 years. Eventually, I knew I had to go in for a transplant. And what changes is your life changes. Trust me. I'm not saying this. I mean, I was always a confident person, but the confidence level now is to a different level. The confidence now is to a different level in terms of everything. I mean, whatever you do looks good on you. You grow a beard, it looks good on you. You wear something funky, which I would never think of wearing, and people say, you can carry it off. You put on a little weight, it doesn't look bad on you. You lose weight, it looks brilliant. You wear a hairband, you style your hair this way, it looks great. You wear a hairband, just flat out, it looks lovely. So anything and everything that you do to yourself looks great, which in a way is a great confidence booster. And then everything starts performing well. You see, when your confidence is high, you're in a great mood, you're getting a lot of compliments from,
From whom? From whom?
Yeah, from a lot of people. He loves to go into controversial territory.
Well, I mean, I think, they say that you are how you feel, right? And so if you feel like you're low and, a lot of people, hair loss may not affect them, but some people, hair loss really does affect them.
Yes.
And so if it affects you, you're just going to project that outward. And when you get that fixed, you project that outwardly too. And you feel confident.
True. So coming back to Dr. Sethi's question, you start getting a lot of female attention, basically.
Yeah.
That's what he's trying. That's what he's getting at. So let me just give it out. And for the viewers, I mean, for the guys, hello.
I mean, yeah. I mean, it's definitely a plus. So yeah, I think that's all fantastic, and I think that it's very powerful, and it looks fantastic. Your hair looks absolutely great. It's crazy how just a small little change like the hairline can do, so much. So we have a question here for Dr. Sethi. What's your experience with Afro hair and surgery, and what's your view about donor fit farming, using BHT to restore the donor area?
So now the first question, Afro is a little bit difficult for because the hair goes inside and that curls up, or there are a lot of splaying, so there is kind of sickling and hooking inside. So when you go deep, and there is chance that you will transect them. But if you are diligent, then what you will do, you initial part, let's say this is the follicle. Let's say this is the follicle. So you will just cut the upper part. The lower part you dissect. You don't cut it, and your punch system should be blunt. And you can your fingers will have that feeling that I have cut the upper part and lower part is not cutting. So you have to dissect. That means you have to separate the tissue. And just for imagination, I'm telling you. And but if you keep doing, and you have the eye and mind to do that, then you'll be able to do that. So initially we were struggling some 3 years back, and we were really crying like, my God. And sometimes some Indian hair is not Afro, but like if you see mine is curvy.
You're curly, yeah.
Curvy. So we knew how to do that, and as I said, 2 years back we were struggling, but now we have become very pro in that. Like we do up to 2,000, 2,500 grafts in one day, and we grow them. Like I'll send you some pictures of the Afro hair, and when they come intact. And now we have got this Trivellini machine that just arrived from this thing from America, Dr. Trivellini's machine, and it has got a suction. Only for that, I got that. I have got of course all the varieties of machines, and the Trivellini was the latest addition that we have, and potentially that is going to suck, and so that the transaction will be very least. And yes, it is difficult. Afro is difficult, but it is quite we do almost 2 to 3 Afro per month now. So that is the first question. The second question was, what is the question? Second question
about donor farming, using BHT to restore the donor area.
Yeah, I did that. I did to some of the patients where it was excessively harvested, and I have done that. I have taken some from beard. Of course, we do for FUT primarily, and in very bad FUE also I have done, and also I have taken something from the chest, where the chest hair is very good. So those patients who have been extensively bald, they require a lot of hair here. That means if the team is not very skilled and experienced, they would over harvest from back, and then then the donor needs to be repaired. So there we have done. So it is quite doable, and of course since it is scar tissue on the behind, you should not be trying to put a lot of hair. it should be kind of diligent. The density that you should attempt should be 50% of what the normal density that we do on a normal scalp. So like, yeah, so we have done many things, and I wish this doesn't happen much. Why? Because growing hair on scalp is very, very unpredictable sometimes. And some people, what they're thinking that let us take a lot from the back and put it on the front, and we will try to repair the back with the the donor farming.
Yeah.
Which is not a great idea. Not a great idea. Like in our hands, in the skill set that we have been able to whatever grade of baldness, Rahul, you know a lot of people, they are like grade kind of 7. If you have a grade more than 7, then they are that grade. So we have done, like, we have taken beard, taken back, and used some of the chest, and we have done amazingly well on the front, and of course we have preserved the back. So that kind of crazy idea of donor farming sounds very non-biological to me, non-organic to me, and
it's better not. It's better not to really, deplete the donor too much, because,
and you should be a smart artist to create the illusion of the density. I remember last time we talked, like, the patient should have the realistic expectation. They should not be dreaming of something like crazy density. And it is the doctor's duty to bring them to reality and give them the point that, you'll be able to hide your scalp. If you look at Ajit, his density is looking amazing, crazy.
Yeah.
But if you go deep down, the density is a little bit, it looks crazy because, like, he has kept calm the way, and of course the density is great, but the density is definitely lesser than the normal density. So, so that is quite, like, this is what ultimately the patient wants, that the scalp should not be visible and without any product.
That's fantastic. And I wanted to personally ask you, and I'm going to get into a question that we have after this, but I just wanted to personally ask you, what makes the temple point reconstruction different than, let's say, the mid scalp or the hairline?
Melvin, the temple is the pinnacle of art on hairline restoration. So the angle, the direction, and curl. That curl is also very, very important. If the curl is upside down, then the hair would stand up. That would look very bizarre. And of course, you have to keep the angle and direction correct. Most importantly, there should be graded entry to the temple. Like, there should be thin, slow growing, and light colored hair on the frontal part. Gradually, once you go deeper, that should become dark. So maintaining all these points correct is very, very difficult. And if you do anything wrong, then that would stand up here. Everything will be visible here in front of the eyes. So that would
Can we take a look at Ajit's? Because you reconstructed his, right? So let me see. Wow, that looks fantastic.
Other side, you can see. Okay.
Wow. Yeah, and you see it's very feathered, very lightly. What type of hairs did you use for the temple points? Did you use the nape or did you use the side hair?
So I usually try to go here, the nape of the neck, but sometimes you don't find good hair there because there might be reverse thinning. So I then try to surf them around the ear. They are thin here. Yeah. So in Ajit's case, like, we have taken from his nape of the neck. If you can come again. So you have taken his temple hair from here.
Yeah, and he has very good, healthy, like, robust donor area. He doesn't have any retrograde alopecia or anything like that. Like some patients have. Some patients, they may not be, they can't do that. But in Ajit's case, his hair is just so thick and robust that, that hair is not going to go anywhere, which is perfect. And it looks so natural.
If you look at your, like, when you are talking to us, you can see your forehead. Yeah. Since your temples are a little bit receded, so the forehead looks big. And Ajit's case, Ajit was looking like you before he transplant, and now because his temples have come, so the hair
more like right here.
Yes. And
it frames the face so much differently. Like if I had hair right here, right, like this is where it would start, which is my forehead wouldn't look as wide. That's the that's the beauty of having the temple points done. And there's another question here, which I'll just kind of ask in my own way because I think it simplifies it. What's the success rate of beard hair transplant?
So that question is
beard
to
to
me.
the scalp.
So, Melvin, in our last 10 years of experience, initially we were extremely enthusiastic in doing beard, and we have done a lot. Almost everybody who is more than grade 4 we have to do at least 2,000 odd grafts from the beard, and we have mastered that. Later part of a career, let's say last 3 years, what we have realized, each and every beard that looks great does not show up here. And sometimes, even if somebody is very fair, the beard, after extraction, the skin behaves differently. And some people have a darker skin, the skin heals within few days, like maybe within 24 hours, it becomes very impeccable. So also the beard hair, when even though it looks very great, plus then some of the beard hair, they grow directly. Some of the beard hair, they fall and they grow very late. And some of the beard hair, they grow with the scalp hair. So very unpredictable. So so now with a lot of knowledge and experience, I would say out of 100, some 90 beard grow well. I can predict them. And 10 hair is unpredictable. But out of 100 scalp hair, I can predict 98, 99. But the beard hair, even though it looks great, I can only be assured of them only 90%. So 10% hair, they ditch me sometimes. I don't know for whatever reason.
So do you think it's better to start off like just a few hundred grafts of beard hair to see how it grows?
No, I don't go by that way, because let's say somebody has come to my office and he wants to fill it up. So that I always try maximum from the back, and beard is always a filling. But if somebody is grade 6, grade 7, then of course you have to use a lot of beard. But even if he grows 90%, let's say he might grow 100% also, but I'm sure that 90% are going to be the minimum. So keeping that in mind and using my scalp hair, I do the job. And anyway, the frontal part is more crucial. And when the patient is counseled well that the front will be looking good and the back will be looking kind of filled, then it says okay. So you have to tutor and teach the patient what is practical expectation, and in that way all my patients are happy, because they are been pre-told that what is going to happen, what is going to do the best, what is going to do the worst.
Yeah. So, because I'm actually interested in getting my beard, but is there a way you can know what beard hair is going to be more difficult to work with? Because I have pretty straight beard hair, so it's not as...
So this is this is more predictable in your case. Your beard seems like Ajit's beard, great beard. So I'll be 98% sure that they will grow well. They will either directly grow or they will grow a little bit late, but they will grow for sure. And they would stay forever. So, and those people who have a straighter beard like yours, they blend with the scalp hair very well. So that is yet another great point. They blend well. They don't stand up. They don't become wiry or kind of weird. And one should not try to use a lot of beard if they can play with the scalp hair. They try to use scalp hair. Beard can be filler kind of thing. And don't use beard in isolation. Otherwise, you'll have that anesthetic feeling in your fingers.
Okay, yeah. So you have to really blend it with the scalp hair in order for it to look good.
Yes. Maybe scalp hair should be 2:1. 2 is scalp hair, 1 is beard hair. So one beard hair is in between, mingled with the scalp hair.
Okay, that's good information. Is Ajit there? I wanted to ask Ajit a question.
Sure.
So this is something that people ask a lot, and as a patient, you'll be able to answer, is how did you keep the hair transplant from other people? Or were you honest with people, like work and stuff like that?
No. So in 7 days of the wash, it doesn't look like you've done anything, right? It looks like a buzz cut, which is done so well, right? If you've done it from Eugenix, it will look really
like
good.
A buzz cut.
So what I did, I completely went buzz. I did it on the 1st of April. April, May, June is generally the tough time, the summer time in India, the really hot season. so there were people ask me, hey, why did you just, go? I said, it's really hot. So I did it. There was a reason why I did it on the 1st of April, because I wanted to, it was my plan to sport up, because I've done so much research, I know where we're going, right? So I had done it in such a way that I wanted to sport a buzz cut. What happens is when you sport a buzz cut, the new hair just looks light, right? Your old hair looks darker. There's not much of a difference. It looks pretty like a normal buzz cut, right?
Yeah.
Your temples look absolutely natural, because temples are anyway light, and your hair over here is also light. So after I did it, about 8 days after my procedure, after my wash, I went to the barber. I said, look, you need to remove this, and you need to shape it up in a way that it looks like I've done a buzz cut. That pretty much camouflaged the fact that I've done a transplant. And to be honest, my in-laws still don't know I've done a transplant.
No way.
Yeah, I've been married 16 years, so they've seen me 14 years with the receded hairline. And the last 2 years, they haven't been able to tell that something's... Because you see, it grows also. It's not that all of a sudden after a month, poof, you grow a big pile of hair. That's not going to happen. It grows eventually, slowly, 3 months, 4 months. By that time, it settles into the eyes of people who look at you regularly.
Yeah.
Yes, I am meeting people after 2 years, and they're like, Ajit, you're looking so different, What have you done? There's something that you've done.
Did you lose weight?
You've grown. Yeah, you've lost weight. The first question is, man, you've lost a lot of weight. Actually, that's not the case. I want to go one step further. When you grow a beard, it also adds length to your face, right?
Yeah.
Right. Now, if I had grown this beard and still had a receded hairline, it probably wouldn't have looked as good. But now I have hair from here, and then, so that answers your question. It's done so beautifully and naturally that there's hardly anyone who can tell. Of course, near and dear ones, I do tell. Now, there are a lot of friends who do have an issue. So how do I help them? I go up to them and I say, hey, listen, your hair is falling quite a bit, Are you planning to do something about it?
Yeah.
There are a few people, 5% only, who say, no, boss, I'm okay the way I am. I don't want to go any further. The moment someone says that, I hold back. I don't want to tell him about my transplant, because he's not even going to go there, right? He's very happy in his own zone. But if someone does say that, dude, I'm really, sick and tired of this hair fall, I want to do something about it, that's when I tell him, look, buddy, I have a solution for you. I have done all the research possible in my 20 years, maybe more than 20 years, And I have come to a conclusion that this particular chain is the best in the world, right? And these fingers are probably the magical fingers that work on anybody's hairline. Also, I would also like to bring in Dr. Arika here, his wife, who also is a great surgeon, and she is brilliant with her hairlines as well. She was it was my good luck that she was also in Mumbai the day my surgery happened. So I had the fortune of her also coming and kind of supervising a little bit in terms of my surgery. And I'm sure she did a bit also. I'm quite sure.
So you got hooked up by both.
I know the best, yeah.
So that leads me to another question, Dr. Pradeep, that a lot of people have been asking me about, these.
Did he step
away?
1 second, yeah. He thought I'll go on in a moment.
No problem. So I guess I'll just. Can we find his wife on Instagram? Yeah, I believe Dr. Arika is on Instagram. I think she's Arika1B on Instagram.
Yes.
I think that's her Instagram page. So, Dr. Pradeep, I wanted to ask you a question, because I'm getting a lot of things on the forum and stuff, and people asking about these different packages, and how do we know if these other packages are as good as you, and such, all this stuff. So I just kind of want to get the breakdown of why you have the packages and what can people expect from the different packages.
Yeah, so we have been doing this work for last 12 years now. Me 12 years, Dr. Arika 12 years. So, and definitely the result that we have produced that is they are getting traction in terms of all of the world people are they're seeking our services, which is good. We are grateful to them, and including your patient from forum and all over they're seeing in the YouTubes and all. And so now I know, like, each and every person they come to Eugenix is our responsibility. So we have developed a process, developed a system where, like, a minimum of some standard of, let's say, a technician will work with us. They all have been handpicked and trained by me for like 10 years, 8 years. Minimum is like 6 years. So they all are working with me day in, day out. So they are my extension of my body. Everybody, like, then the doctors were working, the junior doctors were working with me 4 years, 5 years, 6 years, and almost every day we do one procedure. I do one procedure, Dr. Arika does one procedure, and the junior doctors, three of them, they all individually do. Initially, they they assist us for at least 1 year before they pick up the independent surgeries. That means they have seen at least 300 surgeries minimum, and after that, we do nothing. We don't do any other cosmetic practice. We do only hair, nothing else. We dream, live, drink, sleep, only hair. That's it. So then we have got different category of patients. Some people, they want Eugenix standards, and some people want Dr. Pradeep alone. And I have only 2 hands and I have got only one body. I can accommodate a lot of people, and I want to cater to the whole world. People from USA, people from all over, and also the Indian patients. And we have the responsibility to do good work for them also. So for that reason, we have got, like, 3 junior doctors. They are qualified enough, they're experienced enough to do independent surgeries. Initially, they have, as I said, assisted us. They have observed us, and anyway, we are in the same. Let's say we have got 2 theaters. One I am leading, another the assistant is leading, and if they have got any issue, then I'm always there. So each and every patient goes through the eyes of me and Dr. Arika. However, where my body is more utilized, let's say there is a patient like Ajit, he wants, like, Dr. Pradeep to be like all over, like each and every step should be done through Dr. Pradeep, and that means the skills that I have gathered, the intelligence, the experience that I have gathered, that has got some valuation. If you value my thing, and I know my value, and I'm sure you will agree that the best of the doctors in the world, in USA or wherever they charge, if you see the charges, we are charging almost like maybe 30% of their charges. So, but then, India, everybody is not that paying, and you cannot be arrogant that you stick that price just to accommodate people from all sects. And we have got other doctors, and they're equally good in terms of they have been trained by me, and they have been delivering, and everything passes through me. So anybody who comes to Eugenix, we have got a policy that we will not deny anybody, and they will get something from us, the best quality possible, and
for their price.
Yeah, we have got something for everybody. So for that reason, there are, like, kind of packages where some people, people have done so much research. They ask for things which is not required. Let's say somebody asks, like, Dr. Pradeep, you should extract each and every graft, and which is not required. Let's say there is another qualified doctor who is doing like, I've been very smart so far. What I've done is I've divided my work. Like, I do the designing and the making the slits and sides, and I do extract. I love planting. I'm placing a lot of. I don't know any doctor in the world who loves placing the grafts. I love placing the grafts, and more so on the hairline and the temples. I love them. And but extraction part, Dr. Arika, from the very beginning of her career, she was loving extraction of the grafts, and she loved that, scoring and extraction. And then now we have got more doctors, and we have trained them in that. So these qualified, experienced doctors, they do this part. Let's say I've got one more assistant with me. That person does extraction. We don't delegate to a technician. We don't delegate to a person who is not a medico. We delegate to another fellow doctor who does it, who is experienced and qualified and trained over and under our philosophy and process. And in that way, the workload on my body is less. At the same time, I control the whole procedure. I am responsible for the results. And all the results that you are seeing in the web and YouTube and in a site are combination of, like, I am the leader, but we do have a lot of people around and all are qualified, all are experienced, and we don't leave any stone unturned in giving the best. But as I said, a lot of people, they want Dr. Pradeep to do each and everything which is not required, but that will consume my body and time, and they say we are ready to pay for that extra thing. So then, you know, just to honor them, we have to go for a higher package. That is primarily a preventive package. We don't ask them to go for that. When they press for it, then we have to go for it, because only that will make them happy.
Yeah.
And the lower package is there because we want to accommodate all the Indian patients, and you know, we don't want to leave them out. And almost every day we get 3-4 cases who want to repair their things, and it is very, very pathetic to see them. If they would have come to a good doctor in the first place, then they would not have gone through the butchering, and they would not have come for the second, you know, repair thing. So, so it is a kind of social responsibility, giving back to the society. Then, you know, multiple things are there. For that reason, we have broken, so that everybody is, if you want Dr. Pradeep, yes, he is there. If you want Dr. Arika, he is there. If you want Eugenix system, qualified doctors, great results, but your kind of budget is a little bit less, we are going to accommodate you as well. So we are not going to deny you. Of course, there is something which you cannot, like somebody says something very basic where we cannot operate in that cost, we will say no. But I think the kind of range, so this is what we are doing in India, and mostly people are not complaining. And at one point of time, Ajit was a patient. Now he is working with us. Let us hear like what is his version. Ajit, what do you feel like, you know, this kind of packages that we have floated, and some people are confused, and Melvin is asking for that.
See, Melvin, it's like Dr. Sethi said, it's not about the package, it's about the result, it's about the satisfaction of the patient, it's about the patient coming to Eugenix and the responsibility of Eugenix to deliver. So, if you have a certain amount, you know, like a 75 package, we have whatever, 120, 210, 350 in Indian rupees, of course. That the whole crux of the whole thing is when someone was doing a 75 package or a 120 package or a 350 or a 500 package for that matter, it just is Eugenix's responsibility, and they take that responsibility very seriously. So it does not matter even if there's another doctor that's doing the surgery. I'm sure Dr. Pradeep Sethi takes it upon himself to ensure that, you know, the surgery comes about well. He knows about it. He knows what's going on. And hence, those doctors have also been trained in a certain way, right? To achieve the kind of result that Dr. Sethi has achieved over the last few years, which Dr. Arika has achieved. So, like I said, it's about the responsibility is ours. Your head is in our hands, and have faith, and faith moves mountains. I'm sure I use this line quite a lot. Faith moves mountains. I'm sure faith will grow hair as well.
So I think it's also important for people to understand also, right, that surgeons always have to be trained under another surgeon, right? You don't just graduate and learn how to do surgery. You have to learn from somebody and have somebody teach you, take you, and have them be your mentor. So that's pretty much what's been going on, right? You guys have some, you know, junior doctors being mentored. And I think the most important aspect is the patient knowing exactly who's going to do the surgery the day of the surgery, who's going to do what, right? So in those packages, before the patient agrees, you guys have that.
Yes, he knows. He knows. Everything is clarified before. It's not that he'll turn up on the day of the procedure. And
It is clarified much before.
It's not like that. It's very, very well formulated, very well conveyed, communicated to the patient that this is how it's going to be, this is what is going to be done, etc., etc., etc.
Yeah, so I think that's great. I think having options is perfect. Not everybody is going to be in the same price point or going to be able to afford that. And, you know, in India, cost is a big factor, and you need to be able to have packages to accommodate the domestic audience. You can't just rely on foreign travel.
Yeah, I mean, everybody has a budget, but everyone has dreams, right? You may have a small pocket, but you may have big dreams.
Yeah.
So we want to cater to everyone and, you know, change people's lives. We had a gentleman who came in today, and he had He had obviously done the transplant with our doctors, not Dr. Sethi or not Dr. Arika, but he had done it with the doctor. And he was just so happy. And he just said, you know, my life has changed. I used to walk out. I used to cover my bald patch with hair from here. I used to, you know, put it across this way.
Come
And I
over.
used to be worried. I was worried that the wind would come and it would just blow it away, and I would probably, you know, the hair would look like this because it's long hair, right? You're trying to cover it. It would probably look like that. And he's like, my life has changed. He's like, I'm confident moving out. I'm confident. In India, we have these auto rickshaws, you know, it's like an open air kind of thing. And he's like, I can sit in that auto and I can, you know, be happy. And I'm more than happy to talk to everybody about it. In fact, you know, you could probably do one session with him sometime. He's a very forthcoming guy, and he is really helping everybody for that matter. He comes from a well-off family, and you know, it's not that he needs to do anything like that, but he's helping people and explaining to them that, you know, I have done this, please come here. He got us 2 people who had poor things, you know, gone to different places I wouldn't like to name, but it was just strange. They said they've taken 6,500 grafts from his scalp and he had just 400 over here. I said, what?
Oh, wow.
I said, the first part is it's good that they've not taken all 6,500.
Yeah.
Because that's your important donor area. So although you've paid whatever amount you've paid, you forget about that. Just be glad that your donor area is still very well intact. Whether they fooled you by saying 6,500 is something I'm not concerned, because now in our hands, we'll make sure your donor area is brilliant. We'll make sure you get a head full of hair. You get a lot of coverage with whatever we can do.
Yeah. So Dr. Pradeep, I had one more question for you. Is he there? Yeah,
I'm there.
This is a common question that I get a lot, and it's, what can you have a good dense result with diffused hair loss? So let's say a patient comes in as a Norwood 6, they have all thinning, the whole head is thinning, right? And they want to have dense coverage. Is it possible? Is it better to do, you know, surgeries and, you know, maybe do the hairline first, the mid scalp, then the crown? How do you guys approach it?
So the similar question was put to us to make a video upon that. We did that a few months back. So how to approach or how to do a hair restoration procedure upon diffuse thinning. So now the basics of hair transplantation is, if there is the gap between 2 follicles is more than 3 millimeter, then that would look open. Then scalp is visible. So if it is less than 3 millimeter and still the hair is there, but it is thinned out, then you don't have the space to play. So if it is more than 3 millimeter, whether the hair is thick or thin, then there is enough space to go and place the follicle. Through experienced eyes, through a lot of magnification, and you should have the skill set to do that, and you should have experience how to obviate or how to kind of obliterate the chance of shock loss. So skill, experience, and magnification is very, very essential, and you should be a master of medicine. You should know that what finasteride or Rogaine can give to this patient, and what is the need of the person. If he's the kind of young guy, he want to have a dense look on the front, then if you wait for the medicine to act and kind of thing, then you are losing a lot of his precious youth age where he really wanted to enjoy his hair. So a lot of those things are also come into play when I decide whether to go for a transplant diffuse or not. But we have got enough experience of doing in between, because we do a lot of ladies. A lot of females we do, like female partner baldness, PCOS, and we go in between the hair. We don't trim them, and we go in between the hair, place the graft come out. So we have enormous experience doing on females. So that has helped us to do a lot of diffuse thinning. However, we don't take up every diffuse thinning for hair restoration transplant procedure. We kind of customize whether really socially he needs or not, whether our front job will be enough for him or not, whether he has taken enough medications or not, whether we're going to be very disciplined in medications or not. Lot many things we take into consideration, and when everything is tick, 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 then when we do the procedure, then the skill and passion and diligence comes into picture, we should have magnification correct. We go up to, I would like operating microscope, we go up to like 25x magnification of in making the sites in between the follicles, and place the graft and come out, and very gentle. You cannot be kind of harsh when you make slits. You have to be extremely gentle, and there is no need to do kind of like make the slit very kind of deep down. You have to just cut the epidermis and maybe upper dermis, and when you go to place it, then dissect it. As I said, the very tricky thing, cutting and dissecting are both different things. So you want to dissect, you are like kind of separating the tissue. You are not cutting. You are not exerting any kind of damaging shear force within the dermal plane. So all these things come into picture, and I was more into dermatopathology. In my medical training days, I used to look into pathology part of the skin. So I used to spend almost 3 hours every day in the pathology department to study the reaction pattern of dermis. Me and Arika both together. And I think those memories and those kind of the experience of those are helping us to understand what is going to happen to the dermal plane when you prick the skin. Let's say this is 2 follicles are standing and we have pricked here, and what is going to the collateral pressure? How much pressure is going to get exerted? And I think that the combination of a lot of things together, Melvin, which makes you an expert of doing hair in diffuse thinning.
Yeah, and just before we leave, I wanted to get you guys information just for anybody watching. If you guys want to get you want to send Dr. Pradeep your picture so he can kind of give you a cost estimate or a graft estimate. The email to send it is info@eugenix.in.
The voice is broken, Melvin.
It's info@eugenix.in.
Yes.
Okay. Yes. And your Instagram page is Dr._Pradeep_Sethi, correct?
Yeah, that's mine. Yeah.
Okay, so they can DM you as well and send you questions and stuff like that in case they have it. They can also follow @Eugenix Hair Sciences and send them a DM as well. So I think this conversation has been very helpful, guys. I highly appreciate you guys joining us. Thank you, Dr. To go ahead and put this on the forum and on YouTube, and it's going to help hundreds and thousands of people out there. Thank you, Ajit, for joining me and giving me your story. And
thank you, Melvin. Thank you.
Hopefully we meet in India later this year.
Definitely.
All right.
So Melvin, one thing I've seen that people like you and Ajit who had the hair loss issue, and they sought the answer to that, and they did the research, went through the procedure, and they are the best advocates of the procedure. And rather people trust them more. Like people trust you more than any doctor. People trust Ajit more than maybe sometimes me, because you are on the other side of the table. So, and I would like request past patients to help educate prospective new patients. Otherwise, the amount of corrective surgery that we're getting, I feel sometimes I feel so bad that so bad works have been happened in all of the world. People from all of the world, they come to us to correct that, and I really cry from my heart when I see that. And I feel like I'm in that industry where so much of bad works are happening. So people like you should spend a lot of energy in educating, and you have taken up this as a career. Ajit has taken up this as a career. It's a great thing. And you guys, today Naman has come, that guy who Ajit was talking. I was asking, it is your kind of little bit of social responsibility to educate more people so that they take the right decision. And then the doctors will be more, they will be also kind of putting more energy in terms of their learning, their updating their skills, so that only good things should happen in all of the world in this field, in all the fields rather.
Yeah, I think that's a good point. We have a motto that I like to say, pay it forward, right? People come on the forum, they learn, they look at reviews, they read reviews, but I like to ask them that if they benefit from it, when they have surgery, pay it forward by because it's so invaluable reading these reviews, learning from real patients like I did. And it's really, you know, a recommendation on an advertisement billboard or on a bus stop or anywhere, it means nothing. But seeing it from a trusted, reliable source like a friend, a colleague, you know, a member of the forum, that you know, it's just so much more important than just hearing it from like an advert. So paying it forward is so important. That's a great point, Dr. Pradeep. If you guys are watching, you have, it's important that you guys share your reviews and your knowledge with the rest of the world, because there's so many bad hair transplants happening all around the world and guys getting bought. It's really just a shame, and it doesn't have to happen in 2021. All right, well, thank you guys.
Thank you.
We will talk soon, and don't forget to follow Dr. Pradeep Sethi, Dr._Pradeep_Sethi, and Eugenix Hair Sciences. And if you have questions, feel free to send them a DM. All right? All right, guys. Till next time.
Thanks. Thank you. Thank you, everybody.
Bye.
Thank you.